Another topic, twin epidemics of autism and gender dysphoria. How many of you are touched by autism? Family or your family circles or somebody you know? It's about 5%. Some crowds it's 15%. I have autistic patients. Autism was 1 in 10,000 when I was a kid. It's now 1 in 36. It's the biggest epidemic of childhood in U.S. history. Autism is on fire right now. Sure, we have greater screening and detection, but there is a massive bona fide increase. What we know is it appears to be associated with the expanding childhood vaccine schedule up on the left. When I was a kid, you can see that there was 3 shots, 1960. Now a child today faces 108 shots. At one of the visits between age 1 and 2, there's 13 shots administered altogether in children. And it's been well demonstrated that if a child gets sick with a big round of shots and they have a seizure, there's about a 40% chance that the brain is injured and they develop autism. There's 200 studies now linking excessive vaccination in childhood to autism. There are other factors. No one knows for sure. But autism is related to gender dysphoria. Children being uncomfortable with their gender are more likely to be autistic by a mile. The children who are going so far to actually have surgery and hormones, and it is happening in the United States, are autistic. What normal kid would ever do that? The answer is they're not normal. They have autism. They feel ostracized. They feel left out. They feel uncomfortable interacting, interpersonal relationships. It's a perfect setup for suggestibility and then potentially taking a transgender journey. Yes, that's what's happened. That's exactly what's happened. Transgender medicine, which seemed to have come out of nowhere, in the published studies, the hormones and the puberty blockers make the kids sick, cause acne, sleep disturbance, weight gain, nausea, vomiting, because it's not normal for kids to take these hormones and puberty blockers. The surgeries are disfiguring, ridden with complications, sterilizing. The package of transgender medicine for those under age 18 increases the burden of psychiatric disease, makes the psychiatric problems worse, and increases rates of homicide, suicide, and death from all causes. In a clear analysis, transgender medicine is bad medicine and it causes harm. The solution for gender dysphoria is have the child go through a normal puberty and then have the body develop into the man or female body. Now, if an adult later on has different sexual preferences, and if an adult later on wants to live out the fantasy in the opposite gender, that's their choice. And people can do that. If they do it at their own expense, that's fine. But under no circumstances can our society allow a child under age 18 to head down this very dangerous pathway. Very dangerous. You can tell medicine is in a great controversy when the Endocrine Society, the American Society of Pediatrics, and the American College of Obstetrics and Gynecology fully support transgender medicine. The correct answer on a board exam for an American doctor is for a 10-year-old child who's questioning their gender is to start puberty blockers. That's the correct answer on a board exam right now. Nurses have to take mandatory rotations through transgender units. In Canada, they voted in Parliament that if a parent attempted to stop their child from going through this gender journey, the parent would be criminalized. It was a unanimous vote in Parliament, and they clapped for 5 minutes afterwards continuously, standing ovation for themselves. What is in the minds of people now all over the world? Putin is trying to put down a transgender crisis in Russia. There's a transgender crisis in Indonesia and in Europe and in the UK. Something is wrong. I'm telling you, this is not just COVID. Something is very wrong in the minds of people. In Texas, we saw this developing. Ken Paxton, our Attorney General, had a ban on transgender medicine, and then he was taken out of power because they were trying to impeach him. And so the ACLU stepped in and they stayed the ban. And so it was game on for gender surgery. And all the major academic medical centers, they were all doing gender surgery and hormones. They had transgender departments having the nurses do this. What ethical doctor or nurse or technician or hospital administrator would ever participate in this? Ask yourself this. What? Doctors and nurses can't police themselves? They can't understand what's ethical and moral and what's good and bad? They have lost their moorings? Ask your doctor about this. Ask your pediatrician about this. Attorney General office reached out to me. They said, listen, Paxton is right now taken out of power. They said, Dr. McCullough, we can't find a single prominent doctor to go against this transgender agenda. The transgender advocates are in Austin lobbying for transgender medicine. The Autism Advocacy Network lobbying strong for transgender medicine. I said, you found your expert now. I dropped everything I could. I wrote a report. It went all the way to Texas Supreme Court. And on September 5th, 2023, transgender medicine under age 18 was banned in the great state of Texas. We must show moral and ethical courage at this time. We are in the time of a crisis. Everyone needs to talk to everyone else. That's your great mission. You have to start talking about this. The human mind has gone awry. Thinking is wrong. World Council for Health. Things have gotten so out of control on childhood vaccines and autism. World Council for Health is saying parents are urged to adopt a common sense, safer to wait approach. What does that mean? That means deferring on the childhood schedule. 5 studies now show, in the modern day, 5 studies show children who take no vaccines, none. They're born healthy, they take no vaccines. They're healthier than the kids who take the vaccines. There's lower rates of food allergies, peanut allergies. That's all coming from the peanut excipients in vaccines. There's lower rates of asthma, allergic dermatitis, need for tympanostomy tubes. Lower rates of attention deficit disorder, Asperger's disease, lower rates of autism spectrum disorder by a mile. Massive excessive vaccination is likely harming our children today. And most of us are older. We didn't take that many vaccines. We're not against vaccines. I counted up all the vaccines I took in my body in the course of my life. It's 69. Because I had to take a shot every year to be on hospital staff, and I traveled to places around the world, I took shots. So we're not against vaccines. But excessive vaccines early in neurologic development to children in the ages of, honestly, from newborn to probably 4 years old, it's too much. 50% of all the sudden infant deaths that occur within a week of taking a battery of these shots, 50%. A representative in the state of Louisiana proposed that a child who dies under the age of 1 in Louisiana, with no other explanation, that the medical examiner must review the vaccination record. And you know what? The medical examiners, the coroners, and the hospital said, no, we don't want to see the record. They don't want to know. That's what we call vaccine ideology. They don't want to hear the bad news. They don't want to hear it.